guys, welcome you guys to the Facebook Live today. I want to actually, I got a very special guest with us today. I got one of my friends. His name is Dr. Hall. He's actually going to talk to you guys today about the mouth-body connection, how, our mouth play a big part in us being overall healthy. So I'm going to let Dr. Hall kind of introduce himself, tell you guys a little bit about his background. Can you hear me, Dr. Hall?
Yes, I can, Troy. So thank you for inviting me to be with you today. I'm a dentist by training, and I used to practice dentistry a long time ago in Arlington, Texas. I haven't practiced in a long time. I've been with Dr. McKnight for over 30 years now in research and development. But I practice general dentistry. Now, one of the reasons that I got out of the reason I got out of dentistry is my first wife died of cancer, and I had 3 little ones to take care of. And I always tell people I could be a full-time dad and a full-time dentist. Couldn't quite pull off being a full-time mom and dad and dentist. And because they were 5, 3, and 14 months. So they were little. And so I sold my practice after almost a year. And I taught for a year at one of the junior colleges and did this and that. But I started working with Dr. McKnight in 1989. The thing is Patty, my first wife, who died, she developed the ulcers that you get in the mouth from the chemotherapy, the oral mucositis, and they gave her lidocaine viscous. And I remember telling her, "Oh, this will work for you." All it did was sting, and they didn't teach us anything about this kind of stuff in dental school. So here I'm, a young dentist. My wife's got ulcers in her mouth, and I can't help her. And what the doctors or the MDs are giving her isn't helping. In fact, it's just making it worse. Everything they gave her just was stinging and not working at all. So as it turns out, nothing has ever worked before. And so it wasn't that the doctors weren't any good. It's just it's a difficult situation. It's a difficult condition and hard to treat. One of the things I wanted to do before I died, I wanted to do something to help those people. I couldn't help Patty, but if I could help other people get through this, because oral mucositis is the most morbid common side effect of cancer therapy, radiotherapy or chemotherapy. And it's horrible, and it can be life-threatening. It can be so bad where the ulcers are so bad they can't eat or drink anything. So, but I wasn't smart enough to do anything about this. But when I started working with Dr. McKnight, he's a genius, as you know, Troy. Yeah, and okay, this is what we can do. He actually hired me to help him get started with developing products for the mouth. He thought it wouldn't hurt to have a dentist on board. So that's the reason he hired me. We went to the same church, so we'd known each other a little, not a lot, but we knew who each other was. And so anyway, well, as it turns out, it was years and years later, because next thing I know, I'm running clinical studies in AIDS and cancer and colitis and all kinds of things, always involved in wound care research. So that's where we cut. And ulcers of the mouth, any ulcer is technically a wound. So that's where we finally years later were able to get around to developing products for the mouth. And that's what this product that we developed is for. So if it works for mucositis, oral mucositis, it's going to work for anything. So there are lots of conditions out. We all get a canker sore every once in a while, or a fever blister, which is a viral infection actually, but fever blister or cold sore, depending on what you want to call it. And but we'll burn our mouth eating or drinking something hot. There are lots of situations where we'll have short-term sores in the mouth, but then there are millions of people who have chronic conditions where they have either all the time or recurring ulcers in the mouth, and their mouth just hurts all the time. So if it worked for the oral mucositis that cancer patients get, it's going to help for all those people. So there is never going to be the end for the need of this product. So, and as it turns out, it works very, very well. The very first patient who ever used this product was a grade 4 mucositis patient. Grade 4 is the life-threatening. She hadn't been able to eat or drink anything in 3 days. They were getting ready to put her in the hospital, put her on IVs, save her, and then try to get her to hang on until her mouth cleared up, and then they could start she could start eating and drinking again, and then they could start her therapy again. Very first patient. Actually, she's my older brother, the oral surgeon, got a call, and it was Carolyn's husband who played college football with my brother in college way back in the 60s. And he said, man, nothing's working. She's just really, she's really in bad shape. And do you have anything? Well, yeah, we just developed this. And so he took it to her. She hadn't eaten or drunk anything in 3 days. She was miserable. They all have really bad dry mouths. She could hardly talk. And she was miserable. And so my brother said, just try this. It's safe. It doesn't have any toxicity. There's no drugs, no toxicity, and just see what happens. And well, the next day my brother got a call, and she was eating soup and puddings and soft food. Hadn't eaten or drunk, and even couldn't even drink anything for 3 days. It hurt too bad.
Wow.
And the day after that, he gets a call and said, guess where we are? They were at one of the restaurants eating a full meal 2 days later. And that was just unheard of. So about a few days later, we get a call. Well, it's the nurse from the oncology clinic. And she's the study nurse. She runs all the clinical studies. What in the world is that stuff? Because Carolyn told Carolyn was just in, she doesn't have any ulcers. And we were going to put her in the hospital and save her life, and she doesn't have any ulcers. So, and so she's one of our big fans, of course.
Yeah,
well, same kind of thing over and over again. This was more than 10 years ago. So, well, right at 10 years ago, I guess. So it's been out for a while, but here the same thing. So lots and lots of people that need that. And then, Troy, there's a thing that's been the subject of a lot of research the last 20, 25 years called the oral systemic connection, or the mouth-body connection. Now, in dentistry, we know there are a lot of conditions out there that you'll see things going on in the mouth. You have measles. There are all kinds of viral infections, autoimmune disease, all kinds of things where you'll see ulcers or things going on in the mouth. A lot of times they happen in the mouth before they do anywhere else on the body. So a lot of times the dentist is the one who kind of has an idea that something's getting ready to happen. So we knew that all the time, but what we weren't really fully aware of until the last 20, 25 years is that things that are involved in the mouth infect the whole body, which shouldn't be surprising because I'm one of those who's always said the little toe bone is eventually connected to the head bone. I mean,
Yeah, exactly.
All part of one body. But anyway, the point is this, is they've been able to, through the years, associate conditions in the mouth, and basically it has to do with gum disease. It has to do with periodontal diseases, the gingivitis, or the destructive form called periodontitis, where you actually are losing bone and soft tissue, and the teeth, you lose the teeth eventually. It's an infectious disease because there are bacteria in the mouth, and actually even some fungus, even viruses play a role, but mostly bacteria in the mouth that cause gum disease, but they actually get into the bloodstream, go to other parts of the body, and wreak all kinds of havoc. So they've associated the periodontal disease, gum disease, with things like Alzheimer's disease and Parkinson's. And I'm not talking about making it worse. Certainly it can make things worse because of the inflammation, chronic inflammation is more and more. If you get in the research, you'll see that chronic inflammation is a major problem everywhere, with all parts of the body, because it's so destructive. You get chemicals in the bloodstream caused by inflammation that go to other parts of the body and cause all kinds of problems. But I
didn't mean to interrupt you, John. So it's very important for us to keep our mouth clean. You go to the dentist.
That's where I'm headed. Excuse me. That is where I'm headed, because not only do we know that it can make things worse, there's a lot of evidence more and more that actually gum disease is associated, and the bacteria in the mouth are associated with causing some of these conditions. So Alzheimer's, for example, cardiovascular disease, where you're talking about potential heart attack, or a stroke. You can go to the literature and they say there's just no doubt one of the major players in causing heart attack and stroke are bacteria that normally are found in the mouth, but they get into the bloodstream and go to other parts of the body. They found these bacteria in the clots or the atherosclerotic plaques in these patients, in heart attack patients, for example, cancers, pancreatic cancers, certainly mouth cancers and throat cancers, but pancreatic cancer, gastric cancer, liver cancers, rheumatoid arthritis, just all kinds of different conditions that are involved. Even pregnancy. I mean, we know that pregnancy can do things to the mouth. When a pregnant lady comes in, you expect to see what we call pregnancy gingivitis. They just tend to have more bleeding gums and all that, but it can affect pregnancy and the health of the baby too, the health of the mouth. So the bottom line is, to make a long story short, is keeping that mouth clean and healthy, because what happens is these bacteria normally are in very small numbers. They're anaerobic. In other words, they don't like oxygen. They don't do well in oxygen. So in the mouth, they're able to find a few little places where there's not much oxygen, and the population is very low. But when you start getting little gum disease and you don't keep the mouth clean and you let these build up, and then you start, this tissue starts destroying, it gets deeper. We have periodontal pockets that go down along the tooth. It's getting deeper and deeper, farther away from the oxygen. It becomes an anaerobic or a non-oxygen environment, and these bacteria thrive in that. They start taking over. There's a dysbiosis, or a difference in the population, and then they're secreting metabolites that get into the bloodstream. They're getting into the bloodstream, going to the brain, going to the heart, all kinds of things. So the bottom line is if we keep our teeth clean and healthy, a clean mouth generally is a healthy mouth. It's really a matter of just keeping the mouth clean. So always, you floss and you brush like you should. You can really make a difference in not just the health of the mouth, but the health of the entire body. The problem is when you brush and floss, that takes care of a few minutes out of every day. If you do a good job, and frankly, very few people do a good job. I'll just tell you that right now. It's rare to see somebody do an excellent job. But so the thing is what do you do for the rest of the day? And there are mouthwashes out there that work pretty well. There are prescription antimicrobial rinses out there that work pretty well, but they have toxicities. You're not supposed to swallow them. They have side effects, potential side effects. I mean, the gold standard rinse out there can cause permanent alteration of sense of taste. It can cause ulcers of the mouth. It can cause the development of the plaque and the calculus that cause gum disease. And then, even in other situations where it can even be, I've had two dentists tell me each of them had a patient who nearly died of anaphylactic shock from using this product. And then not only that, they're just harsh. They have chemicals that are harsh on the tissues. You don't want to use them all the time. They're hard on the tissue, the mouth, tissues of the mouth. The product we developed is gentle to the tissues. It's 100% plant-based food ingredients. Troy, there are no drugs, there are no synthetic molecules, or no animal product. It's food, and food by definition is non-toxic. I always say God gave us food to eat, not poison. So it's safe to swallow.
I know it's amazing, John, as you talk about it and you talk about the mouth. I remember probably about a year ago, one of my sisters called me. At least it was like really late, probably like about 12 midnight, and she was having a real bad toothache.
Oh, yeah.
And actually, we up here in Las Colinas, so I ran her a bottle. And before we got up the road real good, about 10 minutes later, she called and she was raving about how, her mouth wasn't hurting anymore. I thought that was amazing for all natural product.
Yeah. Well, and that's the thing. The thing that this product does three things that causes great pain relief. Even though it's all food, there's no drugs, it causes better pain relief than any drugs. There's no narcotics or drugs. And that sounds like you got to be kidding me. No. I'm telling you the truth. And that's one of the things I do is I can explain to doctors the physiology, how it does that. Once they see what it's doing, it makes sense. But the second thing, it controls the microbial growth. It protects from contamination, which is what we're really talking about when we're talking about the oral systemic connection. And then the third thing, it promotes optimal healing. Those are three really unique, really neat benefits that no other single product does. So what people really love is the pain relief when they, like you said, with your sister, but or sister-in-law. I can't remember if you said sister or sister-in-law, but anyway, that's what people like when we all like when we're hurting. But when we're talking about the oral systemic connection, we're talking about keeping the mouth clean. This is really an easy way and something to incorporate into the regular oral hygiene. root, routine for people. And so many people have a history, like I have a history of cancer in my family. I don't have heart disease. I don't have Alzheimer's, cancer. Well, most people either have cancer in their family or heart disease, but then a lot of people have Alzheimer's, a lot of people have rheumatoid arthritis, and all these other situations. Diabetes is there's a major connection between the health of the mouth and diabetes. And so, you know, when we talk about all those, we're talking about everybody. Everybody is either subject to it genetically. They have like me, I have a propensity for cancer or whatever. So everybody can use this to help. We want to prevent. We want to prevent if we can. And so that's the deal. So keeping that mouth clean and healthy is not the only thing, because there are other things we got to do. If you're smoking, you need to stop smoking. If you're doing drugs, you need to stop doing drugs. And you need to stop doing what I try to be as nice as I know how. So I just stop doing stupid stuff, Troy, you know. I mean, I know. And I know people smoking that, but you know, millions of people have quit smoking. You can too. I know it's not easy, but anyway, the point is we need to stop doing all these things that we know are detrimental to our health. We need to try to eat like we should, not eat too much, do the things that we know we should do. But and then brush and floss and all that. But this is one other thing that we can use throughout the day that's safe. And it's very, very effective. Nothing else works like this product. And it's the safest thing going. There's no toxicity, which you just can't say that about anything else. There's no toxicity.
Can you swallow it, John?
I'm sorry?
Can you swallow it?
You can swallow. In fact, if you have sore throat, there's nothing. In fact, I was dealing with a sore throat, a little bit of sore throat the other night. I just, you know, you lean over and let gravity get over it because it's kind of over in the corner. Man, it knocks it out in a minute or so. And the other thing, those cancer patients, they all have ulcers in their throat. Actually, they have ulcers all the way through their GI tract, but they have ulcers in their throat. Everything else out there is the swish and spit product, Troy, because they have toxicities. I mean, even toothpaste. We know we're not supposed to swallow a lot of toothpaste. We don't swallow mouthwashes. Well, this stuff is made to be swallowed. It's food. It's made to be swallowed, and that way those people can take care of those ulcers that are in their throat too. So it's the safest thing going, and yet it's the most effective thing going. Usually when we're talking drugs, the most effective drugs also have the most side effects. Well, this is the safest thing going, and it's also the most effective when you talk about pain relief and when you're talking about healing and then protecting from contamination. I'm proud of it. And it's like I said, one of the things I wanted to do before I died was to help those patients dealing with cancer with oral mucositis from chemotherapy or radiotherapy. Well, we've done that, and everybody else too. So I'm really proud of this product. It's a great product, and you had experience with it too. You know, it is too.
Yeah, you know, I actually use the product every day. I rinse my mouth out with it. And I asked, was it safe to swallow? Because I had a toothache probably about 7-8 months. I mean, not a toothache, a sore throat about 7-8 months ago. Yeah. And I swallowed it, and it cleared up just like that.
It takes a minute.
My granddaughter 8 now, but she love it. I mean, she love it. She actually carried in her little backpack. She carried our little sample bottles of it.
And you know, another thing, Troy, it doesn't numb the mouth like a benzocaine or a topical anesthetic. It just causes pain relief. It doesn't numb the mouth. People want to be numb when the dentist is coming at them, you know.
Yeah.
Something like that. But afterwards, people just want pain relief. This causes pain relief. It doesn't numb the mouth. And that's another nice thing that's really nice that people like. It gives great pain relief without anesthetizing or numbing the mouth. That's just another nice little benefit.
And I think like these days and times, especially what we got going on here with, you know, what's going on, I think everybody need a healthy mouth so they can have an overall healthy immune system. I think people they miss that big time.
Well, this is the deal too. One of the ways that, and thank you for bringing that up, because I kind of skipped over that, but these bacteria get into the bloodstream basically 2 different ways. They get into the bloodstream right from the mouth, but also they're swallowed. We're swallowing all the time, and we're swallowing trillions of bacteria every day. Well, when we're swallowing these bacteria that shouldn't be in these large numbers, we're swallowing them. They make it through the stomach. They get into the intestine, and they take over. And it's called a dysbiosis. It's aberration in the population. The ratios are all wrong, and it just screws everything up. And so what happens, there's a thing called the gut barrier, and the gut barrier it's a single layer of cells. It also has mucus, but it's also made up of the bacteria that are in our gut. Guts also, by the way, gut is the proper term. Some people think that's a crude term. Gut's the proper term. So I'm not being crude. That's just the way it is. So GI tract or gut, but it's called the gut barrier. And the bacteria are very important. And when they get out of balance, then that barrier that protects us from absorbing into the bloodstream from the GI tract things that shouldn't be absorbed, that's another way that the bacteria get into the bloodstream and go to all the parts of the body. The other thing is that bacterial population, and people know about probiotics and all that, that's so important that it's considered, at least functionally, a separate organ of the body. And it's the GI tract, the gastrointestinal tract, and specifically the bacteria are necessary for the proper functioning of the immune system, for the proper development of the immune system and the response of the immune system. And when it's not working right, the immune system isn't working right. And that's part of the problem that we're seeing with all these conditions. We're getting a filthy mouth, and we're getting gum disease. It's getting down into the GI tract. It's messing up the GI tract and the bacterial populations, and that's affecting the whole body. So there are lots of different ways, but it all goes back to the mouth and keeping that mouth clean and healthy. So to keep the immune system functioning properly, we got to have the GI tract healthy and functioning properly. And when we're swallowing all those bacteria that shouldn't be they're in the mouth, but they should be in tiny, tiny numbers, but now they are dominating, then we are really causing major problems. And all it is we just got to keep our mouth clean and healthy. That's all it takes. And a nice, safe, easy thing to add to the regimen is this product.
Wow.
And really make a difference. And we're seeing that from people all the time.
Yeah, I mean, we heard this. Yeah, we hear the stories all the time about people using the product, guys. And if you guys want to learn more about this product, you can easily message me. And if you don't want to message me, message Dr. Hall. He'll answer your questions. If you're a dentist and you want to know about this product, you most definitely want to reach out to Dr. Hall. He can actually explain it. What I'm doing here, guys, seems like every week for the past month, I've been actually having different doctors on speaking about, different subjects, but it all boils around the immune system, because I truly believe that if all of us have a healthy immune system, if we do come in contact with what's going around, our body will be able to fight it off real fast. And we won't get as sick. So I want to thank each and every one of you guys for tuning in today. I want to thank you, Dr. Hall. Like I said, if you want some information about this product, reach out to me. Reach out to Dr. Hall. You can actually message us. You can message him on Facebook or message me. He got his email up there. You can even email him, and he'll give you information if you want about it.
Yeah, just email me or call. I check my email several times a day. I get about 700 emails a day, but I go through them. So,
hey, Dr. Hall, one more thing before you leave. I know it's one thing that you still do with dentists. What do you do? I think it's
Well, I mean, I still talk to we have the dentists are using this product more and more. And then there's another product. It's the same thing. It's just a gel form. This product we're talking about is a liquid. It's a rinse that you can swish around the mouth. There is a gel form that dentists are using after they do extractions or surgeries, and it's in a syringe, and they can put it right down the extraction site, and they don't have to send them home with prescriptions for narcotics or pain medications, and they heal so fast and they stay comfortable, and people like all natural, drug-free, non-toxic. So what I do is in fact, I did that last week, and I've got another one set up here, but I'll go talk to them. Sometimes they want me to come to the office. Whoops, sorry. Sometimes they want me to come to the office, and I can explain how it works. I can explain the biochemistry, because again, food, some of them want to turn their brains off. That can't do anything, because we just think it's got to be a drug. But I can explain to them how it works, how it causes pain relief, how it stimulates the healing process, because that's already been figured out. This is science. And then how to use it, and it's real easy to use. Anybody can. So you send it home with the patient, have the patient use it. So I'm teaching, what I teach dentists and oncologists and MDs who are using this for their patients, the science of the products and how it works and how to use it. So I'm talking to them all the time. So any dentist or hygienist or dental assistant who's interested in knowing more, please contact me. I'll be happy to visit with you and even come to your office if I can, or do a webinar. I do webinars all the time, and I have CE. When I explain these products, they're also approved for CE, by the way. They get continuing education credits, so a lot of them like that. So I'm talking to dentists and other doctors all the time.
All right, cool. But thank you, Dr. Hall, for joining me today. I really appreciate your time. I hope this helps some of you guys out. You got to have a healthy mouth for your body to be overall healthy. If you want to learn about this all-natural, 100% plant-based product, just message me or shoot Dr. Hall a message or email. With that, I'll see you later, Dr. Hall. You have a great evening.
You too. Thanks, Troy.
All right, God bless.
You too. Bye.